Hello and good evening. My name is Michael Jaluli, and as part of my Biology 235 course, I am to create a video indicating the axial bones and answer questions regarding certain bones, such as the opening and/or functions of these bones. We'll start with the cranial bone. The cranial bone here, the frontal bone, is the front of the skull, as you can see here, again being the frontal or front of the skull. The parietal bones are going to be on the sides or the lateral sides of the skull. We have one parietal bone listed here, and we have another one indicated here. We have the occipital bone, which is on the posterior side of the skull. Down here at the bottom, we have the occipital bone here. The external occipital protuberance is the bony protrusion or bump where the muscles keep the head upright and allow the head to tilt backwards and forwards. You can see it here vaguely. If you were to touch the back of your skull, you can also feel that bony protrusion at the back of your skull, that being the external occipital protuberance. Moving forward, we have the temporal bones. We have the lower lateral sides of the temporal bones, temporal bone being here. You can see the suture that I have drawn here with my marker, the suture, and just inferior to the suture, we have the temporal bone, and on the other side of the skull, we also have the other temporal bone indicated here. Externally, the temporal mandibular joint would be located here. I know it's tough to see, but with the equipment given to me by the course, this is the best I can do. Unfortunately, this here again is the temporal mandibular joint, indicated here with my pencil, between the mandible and the temporal bone. The mastoid process is going to be here with my pencil, that being the mastoid process that is inferior to the temporal bone, and we have the styloid process, which is also in the same region. Again, very difficult to see, but that being our styloid process inferior to the temporal mandibular joint. The external acoustic meatus is going to be here. The external acoustic meatus internal to the zygomatic process, inferior to the zygomatic process of the temporal bone, and is a tube running from the outer ear to the middle ear. Again, that would be here, right where my pencil is, the point of my pencil. The squamous suture. The squamous suture is another portion of the temporal bone and the parietal bones. Again, the suture being right here, the squamous suture, pulling together the temporal bone here and the parietal bone just above it. We have the internal view of the petrous part of the temporal bone, or the petrous part of the temporal bone. The petrous part of the temporal bone houses vital structures such as the cochlear and vestibular end organs, the facial nerve, the carotid artery, and the jugular vein. Petrous part of the temporal bone, if I were to open up the top here and look at the skull from the inside, you can see here that with the sphenoid bone, the temporal bone or petrous portion of the temporal bone would be here where my pencil is. Again, just inferior to the sphenoid bone. The interior acoustic meatus, what passes through this would be the internal acoustic meatus and/or IAM, is the facial nerve, the vestibular cochlear nerve, the vestibular ganglion, and the labyrinth artery. Again, the internal acoustic meatus, that would be just adjacent to the temporal bone or the petrous portion of the temporal bone, indicated right here where my pencil is. Again, very difficult to see, unfortunately, with this equipment, but again, the external internal view of the acoustic medius would be right here. If we were going to look at the sphenoid bone again is marked here with the two greater wings, the greater wing being here and also here. And if we were to look at the greater wings from the exterior view, we would find that they would be within the orbitals where my pencil is at, indicated here and or here. Again, I took the top portion of the head off so that we can have a clearer view of the sphenoid bone inside the skull. The greater wings of the sphenoid are two strong processes of the bone which arise from the side of the body and are curved upward, laterally, and backward. The posterior part of each projects as a triangular process that fits into the angle between the squamous and the petrous part of the temporal bone. Superior orbital fissure, what passes through the superior orbital fissure would be the oculomotor nerve, the trochlear nerve, the lacrimal nerve, and the abducens nerve. The superior orbital fissure would be located here inside the orbit. There are two holes, if you will. They're within the orbits that indicate the positions of the superior orbital fissure. The lesser wing within the sphenoid bone would be right here where my pencil is at. Again, that's just above the greater wing. And again, we're looking here at the lesser wing, greater wing being just below it. The interior, the lesser wing, again, better described, would be interior to the foramen magnum on left side, left lateral side, in front of the bone. The greater wing would be anterior to the foramen magnum on the left side, rear side of the bone. Again, here is the greater wing and the lesser wing just above it. The optic nerve, what passes through the optic nerve, optic canal, the lateral optic nerve, I wanted to show you the position of the optic nerve is indicated right here where my pencil is at. Again, the optic nerve is here, or optic canal, the optic canal is noted here, lateral to the greater wing. Passing through the optic canal is the optic nerve and the ophthalmic nerve, the stella trochlea, also known as the saddle. The stella trochlea is part of the sphenoid bone and is located just behind the cavity known as the sphenoid sinus. It houses the pituitary gland, and that here, again, is the stella trochlea, also known as the saddle. The ethmoid bone is located in front of the sphenoid bone. In front of the sphenoid bone being here. Again, we're looking here at the ethmoid bone is located in front of the sphenoid bone. It contains two masses, one on each side of the nasal cavity, one being here and then over here of the nasal cavity, which is joined horizontally by a thin cribriform. Internally, the crista galli. The crista galli is a medium ridge of the bone that projects from the cribriform plate of the ethmoid bone. The crista galli secures the dura mater of the bone. The crista galli, again, would be indicated here where my pencil is. Right here, again, is the crista galli. And the cribriform plate would be just above it, right here where my pencil is at. Cribriform plate. Small unmethylene axons from the olfactory receptor bipolar neurons pass through the small holes of the cribriform plate of the ethmoid bone. Sutures, moving on to sutures here. If I were to put the top of the head back on. Putting the top of the head back on, looking at the sutures, we have the coronal suture. The coronal suture joints the front bone and the parietal bones. So this here being our coronal suture right here. We have our sagittal suture, which joins the two parietal bones, listed right here. We have the lambnoid suture joining the parietal bones and the occipital bones, that being back here. And then we also have the squamous suture, which join the parietal and the temporal bones. Again, we have the squamous suture right here. Moving on to the facial, we have the maxilla ulvar process. The maxilla would be this here, just above the teeth. Again, here indicating the maxilla. And then we have the ulvar bone also indicated or shown here with the maxilla. Down here, I'm sorry, this here being the alvar bone and the maxilla bone right here. The alvar is the bone of the upper and lower jaw which support the surrounding teeth. We also have the nasal being right here, nasal bone right here. We also have the zygomatic process, the zygomatic arch. And what bones form the zygomatic arch? We have the cheekbone, and it's made up of two bones connected together. The first bone is called the temporal bone, and it extends from the side of the head or skull of the upper jawbone. The second bone is known as the zygomatic bone of the cheek, and that's indicated right here. Right here would be our zygomatic bone. Moving on to the ethmoid bone. The ethmoid bone is located in front of the sphenoid bone. It contains two masses, one on each side of the nasal cavity, which is joined horizontally by a thin carabiform. Again, we have right here, where my pencil is, we have the ethmoid bone. Okay, the vomer bone and perpendicular plate of the ethmoid bone, indicated right here where my pencil is at. The inferior nasal concha, located below the superior and middle concha of the ethmoid bone. The inferior nasal concha helps to swirl and filter air entering the nasal cavity, trapping particles in the mucus before air gets into the lungs. Inferior nasal concha. And that would be right here, inferior nasal concha. Moving on to the mandible. The mandible forms the lower jaw and holds the teeth in place. We have the body indicated here of the mandible. We have the angle noted right here. If you can see the angle right here. We have the mandible condyle, which is noted. Mandible condyle noted right over here, mandible condyle. We have the mandible notch, which is noted here by the zygomatic bone. And we have the conroid process, which is also just anterior to the mandible notch. Mandible notch here, and the conroid process right here, excuse me, where my pencil is, and just behind it we have the mandible notch. The vertebral column, if I were to look at the vertebral column from the back here, we have primary and secondary parts of the vertebral column. The four curves of the adult vertebral column include the cervical, the thoracic, the lumbar, and the sacral. The thoracic and the sacral are considered to be the primary, while the cervical and lumbar are secondary. If we were looking at the spine, again, we have the cervical portion of the spine right here, which are the first 7 vertebrae in the neck. And below that, we have the next 12 vertebrae, which would form our thoracic part of the spine. And the lower portion here would be considered our lumbar, and then the bottom here is the sacral. Going back to the cervical vertebrae, we have the atlas. The atlas bone is the first cervical vertebrae, C1 if you will, that supports the skull. From the superior surface of the atlas vertebrae are a pair of concave facets which articulate with rounded condyles that project from the inferior aspect of this occipital bone. This allows the head and to nod back and forth. So we have here the atlas noted right here. What's unique about this, about the transverse process, is that, or what's unique about the cervical vertebrae compared to those of the thoracic and lumbar, is that 7 bony rings that reside in the neck between the base of the skull and the thoracic vertebrae are the thinnest and most delicate, yet have a huge job in supporting the neck, protecting the spinal cord, and provides mobility to the neck. Moving on to the thoracic vertebrae, again we have 12 in this region here that start right here and move down 12 vertebrae, forming our thoracic. We have the spinous process, which are the fine bones that extend posteriorly to the spine. Again, if I can point to it right here, we have our spinous process. A transverse process would be the 2 bones that project laterally from this spinous process, and we have the intravertebral foramen, which is probably better seen from the front of the body or the skull, or even down here. We have this rounded portion here that creates our intervertebral column. What passes through the intervertebral column is it allows that the intervertebral foramen allows the passage of spinal nerve roots. Moving on to the position of the intervertebral disc, those lie between the adjacent vertebrae and the spine. Excuse me. The lumbar vertebrae state how many. We have 5 individual cylindrical bones that form the lumbar spine. We have the lumbar spine down here at the bottom here. We have the sacrum. The sacrum is indicated right here, and just below the sacrum is the coccyx. The 5 vertebrae that begin to fuse in here in the sacrum usually fuse in adults between the ages of 16 and 18. And in the coccyx, we have the 3 or more bones that fuse together at the bottom of the spine, which is indicated right here where my middle finger is at. The sternum, moving on to the sternum, we have the sternum we have commonly known as the breastbone, which is the long bone that you see right here. We have the manubrium, which is also just above or superior to the manubrium. We have the xiphoid process, which is down here at the bottom, the pointy bone here. And we have the jugular notch, which is indicated up here, superior to the xiphoid process. We have here again the jugular notch. Moving on to the ribs, we have 2 different terms. The terms true and false ribs describe ribs pairs that are directly attached to the sternum. The first 7 directly attached to the sternum are the true ribs, and those below are considered false ribs. So we have 1, 2, 3, 4, 5, 6, 7 ribs here that are considered the true ribs, and then we have the remaining ribs down here that, because they're not directly attached to the sternum, are not considered true rib, but rather false ribs. Floating ribs are the ribs that we have down here, and you have one floating rib here and one floating rib over here. Again, floating because they're not attached to anything, rather they're just attached to the vertebral column. If I were to point out the neck would be indicated, the head. I'm going to start with the head. The head is directly attached to the vertebral column. Adjacent to that, we have the neck, which has a little notch to it here at the top. And then adjacent to that, laterally, we have the tubercle. And the head articulates with the demifast, and the tubercle articulates with the costal facet. And that's my presentation today. Thank you.